graduated from Department of Psychology at Wilgie University, then from Department of Mental Health and Psychological Therapies at Queen Mary University of London. She completed her undergraduate internship at the Psychosis Service at Baker K Mental Health and Neurological Diseases Hospital, and her master level clinical internship at London Enfield Hospital Depression and Anxiety Disorder Clinic. As part of her master level internship, she received supervision on cognitive behavioral therapy and cognitive analytical therapy. She received her master's degree with a thesis entitled Risk Factor for Mother Postpartum Depression. She worked with the child and adolescent groups with addiction and behavioral disorders in public agencies. She currently serves as a clinical psychologist at Green Crescent Consultancy Center, conducts psychotherapy with addicts, administers psychological tests, and manages the clinical and administrative condition of centers. She conducts research on awareness-based application in the treatment of addiction. Dear participants, our session will last for 1 hour. 40 minutes will be for the speaker presentation and 15 minutes for your question session. Please kindly mute your microphones, open your cameras, and please add your country next to your name. Without further ado, I would like to give the floor to Dr. Malika. Dr. Malika, the floor is yours.
Okay, thank you, Amal. Hello, everyone. My name is Melike Şimşek. I am a clinical psychologist working with Turkish Green Crescent Counselling Center, and I am also the clinical lead of the centers. And I'm so happy to take place in this great program and meeting you today. So let's begin with my presentation. Today we will talk about substance abuse, and we can also call it drug addictions. And I will share my screen with you as you can follow the slides. And in the last 20 minutes, I would like to hear your comments and also questions. So I think I'm now sharing my screen, right?
Yes, Dr. Malika, we can see the screen.
Okay, thank you. I'm gonna go to full screen. Okay, now let's start with the definition of addiction. What is addiction? It's a complex condition. It's actually a disorder, and also we call it a brain disease. And it is manifested by compulsive substance use despite the harmful consequences. It is also a psychological and physical inability to stop consuming a chemical, a drug, or an activity such as online gaming or shopping or smoking tobacco or substance, even though seeing the psychological and physical harms at the end. It's basically an inability to stop or control this excessive compulsive using. What is drug addiction? Let's be specific. It is also called substance use disorder, and it is a disease that affects a person's brain and behavior, and it leads to an inability to control, again, the use of a legal or illegal drug or any kind of medication. This can be like prescriptive medications or any other painkillers as well. The basics of addictions are consisted of 4 main areas. One of those is the person's mental health and emotional well-being. This affects the person to get addicted, and also it is affected by the consequences of substance use, addiction. And the second area is familial relations. It is also important, and that's why we try to involve the families in the treatment process in order to reach a great level of success in treatment. And the third area is physical health. Physical health is negatively affected by substance use And sometimes it also affects the person to start substances, using substances. And the fourth one is the social environment. Social environment can lead the person to start using substances, trying substances, but at the end, it is also affected by using those substances, because we see that people become more introvert and shy after a while of addiction process. So they want to keep alone. They just want to see no one but their sellers. So the social isolation starts at this point, and the social environment is unfortunately negatively affected by the process of using. Addiction is a recurrent disorder. What we mean by recurrent is the person who starts using those substances quits and starts again. And after a quitting process, starting again is called relapse. So it's going on with many relapses. So we can say that it's a recurrent disorder. And that's why it is also a lifelong brain disorder. We talk about the inability to control using. So that means some of our brain mechanisms are distorted, are damaged by using substances. That's why we call addiction is a brain disorder. Brain craves the substance after a while of using process. Sometimes people say that I don't want to use, I don't want to go and find any substance, but I feel like I have to do it, I must do it. That's why the brain craves that substance and wants the person to go find and use those substances. So this shows us that it's not just a matter of choice. And this is what we are trying to tell the families, that this is not only a choice. It might be a choice in the beginning, but it's not a choice after a while, because the brain cannot control. So the person has no control on distorted brain mechanisms. There are some signs of addiction. When we see these signs, we can think of a situation that the person is being addicted. The first one is the withdrawal symptoms. Withdrawal symptoms refer to the physical and psychological symptoms that can be seen when a person quits using. And it depends on the amount of use, on the type of substance use. It varies on different substances and different amount of use. And the amount of substance is increased by time. It never remains the same. It is increasing eventually and gradually. And the vicious cycle of using and quitting starts. When I see my clients, most of them tell me that they have more than 10 attempts to quit. But on those 10 attempts, they always start using again and again. This is also a sign of addiction. This can show us that the control mechanism is now damaged. And you can see the social, familial, and also occupational damage as well. Those people start getting problems in their social life, in their family life, and also at work or at school. Okay, we have seen those signs, but is it enough to call someone addicted, or is it enough to diagnose them with substance use disorder with just those signs? Of course not. As it is a disorder, there must be some criteria, and this criteria is from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It is often called the DSM-5. It's the latest version of the American Psychiatric Association's gold standard text on the names, symptoms, and diagnostic features of every recognized mental illness, including addictions. The DSM-5 criteria for substance use disorders are based on decades of research and also clinical experience. And the first criterion is taking the substance in larger amounts or for longer than you are meant to. This also shows the lack of control on substances. And the second one is wanting to cut down or stop using the substance but not managing to. And third one is spending a lot of time getting, using, or recovering from use of the substance. See that substance use now is on the center of the person's life. Cravings and urges to use the substance. This is one of the most important criterion of those 12. And not managing to do what should at work, home, or school because of substance use. Continue to use even when it causes problems in relationships. And after a while, the person gives up important social, occupational, recreational activities because the only thing in the world for him or her now is substance use. And using substances again and again, even it puts you in danger. For example, taking substances or drinking alcohol and driving car. You might have some accident, but it doesn't matter for you. You still continue using. And even you have a physical or psychological problem that is triggered by substance use, you're still using. And needing more of the substance to get the effects you want. This is what we call tolerance. We develop tolerance over time to substance use. And development of withdrawal symptoms. These can be physical or psychological. And these symptoms are relieved by taking more of the substance. That's why a vicious cycle is created in the end. So you should detect 3 of these criteria in 1 year to diagnose a person with substance use or drug addiction. Here is a picture that visualizes the most important criteria for you. As you see, neglecting other parts of the life or problems in relationships, or wanting to cut down or stop but not managing to. This is like criteria for substance abuse disorders in a nutshell. Addiction is considered as a multidimensional problem. Why? Because it's a health issue. It's a disorder and it's related with other mental problems and serious physical problems like hepatitis or HIV, etc. And it is also a social issue because it's related with homelessness, crime, and violence. And also it is an economic issue because when these people uses services again and again, it costs for society and for other individuals. And also the lack of productivity and causing accidents because of substance use makes it an economic issue as well. So here are the 3 dimensions of addiction disorder. And I would like to show you a metaphor that we use very frequently. You can see on the left that there is a hypertensive patient using salt, and at the end, the consequence is high blood pressure. But when this hypertensive patient goes on a no-salt diet, there will be normal blood pressure. And after 5 years, when this person is going on a no-salt diet, if he uses salt at just one time, there will be high blood pressure again. As you see here, high blood pressure...
There is no sound.
Sorry?
You may continue, Dr. Malika.
Okay. So why is this happen? Because the system is damaged once. We can relate it with addictions. If a person remains sober or clean for 5 years, but after 5 years, even try once, she or he will back to the starting point again. That's why we call it a lifelong disorder. Okay, we've talked about the negative consequences, the effects of those substances. Why do people use substances? What are the reasons? Of course, it isn't not possible to talk about just one reason. Sometimes one of those is superior, or sometimes you can see a combination of those 5 or 2 or 3. But the research and clinical experience is categorize them into 5 categories. Like first one, individual factors, the second one, peer factor, the third one is family factor, and the fourth one is school factor, and the fifth one consists of environmental factors. Let's look at what those individual factors are. People usually start using or trying these substances in the adolescence period. It's a hard period, it's the transition period, and there might be some adaptation problems. And at this point, when those teenagers meet with substances, they start using them regularly, easier to the adults. And there is also curiosity in this period. And normally, curiosity is a good thing to discover new stuff, but consider a teenager with a high level of curiosity. Sometimes they would like to experience dangerous things, harmful things as well, like substances. And again, during this adolescence period, teenagers usually try to look different. And they think that smoking cigarettes or trying substances, drinking alcohol, makes them look different from others. And also it's a way, but an artificial way to get away from problems. When they have a breakup, they can think that drinking alcohol till morning makes things easier. But after they wake up, they face with more serious problems compared to a breakup. And sometimes if a person has some problems with life skills like communication skills, ability to say no, these can also make him or her to try or use regularly those substances. We can also talk about some characteristics like aggressiveness, depressive mood, introvertness, and attention deficit. Second one is peer factor. You know that peers play important roles in our lives, but especially during the adolescent period, imitating abnormal behavior is very easy to stay in the peer group, not to get excluded from that group, so that they can help each other in trying, reaching, continuing to use substances. Also, if in that peer group using substances can be considered as a normal thing, then the others would easily continue or try. That's how peers affect a person to try or continue using substances. The third one is family factor. We've talked about how we call addiction. We call it a brain disorder, we call it a disorder, and we also call it a family disorder, because family plays an important part in developing process and also in the treatment process. If there is a lack of strong bonds between child and the parents, this makes the grounds for substance use, unfortunately. And also lack of family control, but very authoritarian parents who has strict rules, who has high level of controls, also doesn't help with this problem. So they should be somewhere in between. And if there is a role model in substance use in the family, like if it is considered as a normal thing, as a part of daily life, then the child who is grown up in that family can easily start and can easily get addicted. And if there's inappropriate borders for the child, this is another reason. And if there is neglect or physical or psychological abuse towards the child, this would be another factor. Weak bonds with school or behaving unacceptably in the classroom are the factors related with school. And these kind of children, research shows us that can easily be getting addicted. So the parents should observe and be careful with those kind of kids. And if there is increase in escaping school behavior, this is also a factor. And also at this point, the school administrations are really important. If there are lack of control in users' network, then the use in that school will be spread through others. For example, I had a client who was a teenager. He was telling me about how he met the drug at school, how he tried for the first time, and how he bought it from other students. And I was like shocked how the school authorities doesn't know about this. So they have to be aware of what is going on through these users' networks. And if there is a lack of prevention strategies through discipline problems, this is another factor. Environmental factors include society's attitude towards substances and addicted individuals. On the right, I wanted to show you a photo that is taken from one of the most problematic neighborhoods in Istanbul. And it says, in this neighborhood, it is prohibited to smoke synthetic cannabinoids like Jamaica, bonsai, and it is also prohibited to sell those drugs. And it is signed by Cennet Çeşme youth. Cennet Çeşme is the name of those neighborhood, and it is really motivating to prepare like a banner and hang on the streets by youth. That's why I would like to show you how society affects the use of youth. And also environmental factors include laws and their applicability, and the perception of easy to reach, especially in some neighborhoods. People think that, oh, it is really easy to reach. I can go and buy any substance I want. This is also a factor for a person to try and start using regularly. And local authorities have many duties to stop using. And if there are lack of investments, for example, if there are no sports centers, no recreational activities for youth, and then they would like to use substances very easily. Also, poverty and unemployment are two important factors that can be categorized as environmental factors. Okay, let's talk about what are those addictive substances. First one is the most legal and prevalent one, tobacco. And the second one is also another legal one, alcohol. And the third one, opioids. Opioids is the classification of those substances like opium, morphine, heroin, methadone, codeine, and stimulants, cocaine, amphetamine, methamphetamine, and captagon, cannabis, LSD, magic mushrooms, herbal spices, synthetic cannabinoids like bonsai or Jamaican, and also prescription drugs like for tranquilizers or the drugs that are prescribed for anxiety disorders, and inhalants like adhesives, thinner, and lighter gas. You can see the pictures of those substances, and I'll talk about those in detail. As you see, the cannabis is a plant, and Opioid is also a plant. You can see the milk over the plant, which is the addictive part of the plant. And also cocaine is made of the leaves of the coca tree. And you see the methamphetamine. So let's start with cannabis. It's a sativa plant, and the major effective component is called THC. Cannabis has male and female types. Yes, it has a gender, and it is produced by the cannabis, the addictive substance is produced by female cannabis. It is the most prevalent illegal substance used in the world, unfortunately. And I'd like to talk about the street names: marijuana, Mary Jane, ganja, and in Turkey, cigara, hashish, and ot are the street names of this drug. And cigarette use, when you mix it with tobacco, is called joint, and people can also use it by hookah, which is called bong. The intoxication effects are anxiety, irritability, panic attacks, memory damage, disability in learning new stuff related with memory damage, and laziness, lack of desire, which we call demotivation syndrome, paranoia, and psychosis risk is higher, 7 times higher compared to non-users. And there is also a risk of lung cancer and asthma. And let's see. Sorry. Withdrawal effects: bad temper, tense mood, insomnia, loss of appetite, and these can be seen up to 6 weeks, the withdrawal effects. Synthetic cannabinoids are usually known as Bonsai, Jamaica, and Gold, but these are the brands, not the name of the substance. And it directly affects the brain, and it is 14 times harmful compared to cannabis. Sometimes people think that the harmful effects are more or less the same with cannabis, but it is more harmful. And it comes in many forms. So there can be seen various damages, but the most common one is kidney failure. It is highly addictive, and again can be used by tobacco, pipe, and bong. And the risk of psychosis and suicide is high. Again, there are paranoia and hallucinations. Opioids are also the most, one of the most addictive substances. And in opioid class, we can count heroin, codeine, morphine, methadone, and buprenorphine. In intoxication effects, we can see unresponsiveness, breathing problems, decrease in body temperature, decrease in heartbeats, in blood pressure, and after all this, there can be seen coma and death. In withdrawal effects, you can visualize a person having a strong flu with nausea, vomiting, diarrhea, stomach ache, joint pain, but these withdrawal effects doesn't cause death, and it can be seen up to more than a month or more. So let's check cocaine. It is also the other form of cocaine is also called crack, and the most common use of cocaine or crack is sniffing. It is also used by specially produced glass pipes or by hookah, tobacco. Very rarely, but IV use can also be seen in cocaine. It has a short effect, like 30 to 60 minutes, but it can stay in urine and blood up to 10 days. Its effects are short, so that's why people use very frequently, like for example, in a party or in a nightclub, they start using cocaine till the sun rises. As you see, they would like to increase the effect of the substance. It is highly addictive, even for one try. And the Intoxication effects are over cheerfulness, loss of appetite, increase in sexual activity, hyperactivity, and less need for sleep. You can see on the right side a nose with a hole after very long cocaine use. And nose bleeding and damage can be seen. Lung damage also be seen. Habit spasms, strong headaches like migraine, and there can be stroke due to brain vessel blockage and also brain vessel bleeding, and sexual dysfunctions like delayed ejaculation. And the next one is ecstasy. You can see that ecstasy comes in many different forms, colors, shapes, and some of the famous brand logos on it. That's why the youth prefers ecstasy, and they try to produce them in an interesting way. So it causes panic attacks, depression, hallucinations, sleep problems, and also increase in body temperature, and unfortunately sudden death, and also over dehydration, and some other problems related with dehydration can be seen. Loss of pleasure and loss of ability to have fun without ecstasy. This is very important, and this is something we hear from our clients very frequently. They say that without ecstasy, there's no meaning in life. I can have no fun. I feel like I'm in depression all the time when I don't use. But this is how it damages those brain areas. And sometimes there is buzzing in the ears, and people say that they hear voices in the brain. I would like to show you a brain scan showing normal brain and the brain image under ecstasy use. You can see that on the right side, there are less of red areas, which shows the loss of vitality actually. So you can see how ecstasy affects a person's brain. Amphetamines, methamphetamines, unfortunately, we started to see more and more of people who are addicted to this substance in our country. It wasn't that common a few years ago, I can say that. It is highly addictive, and it causes circulation problems, breathing and neurological problems. It also causes anxiety, violence, depression, and paranoid psychosis. It's called ice, meth, and crystal. These are the street names. And the most common use of amphetamines and methamphetamines are sniffing, swallowing. It's not very common, but rare IV and tobacco use. Okay, how can we understand if a person is using those drugs or not? There are some ways like personal look, health issues, habits and actions, behavioral change, issues related with school and work, family life and social issues, but we cannot judge a person with just personal look. We have to have some proofs, some concrete things to call or to suspect that he or she is using some drugs. In personal look, we see messy look and especially lack of self-care, lack of hygiene, flushed, red cheeks and eyes, sometimes burnt fingertips or lips, and there are usually marks and scars on arms, legs, and there is also an attempt to cover those even during summer. And on the right side, you can see the change of a methamphetamine user in 6 months. This shows us how methamphetamine affects a person even in a very short period. Health issues include nose bleeding, scars in the nose, mouth, or all over the face, and nasal flow. Apart from flu or allergic things, especially in cocaine users, we can observe this. being ill very frequently without any reason, nausea and vomiting, or sleepy mood or insomnia. I'm trying to get faster. In habits and actions, unexpected smell on clothes or breath can be observed, or leaving home early, coming back late without any explanation or reason. Need for cash is also very obvious, inconsistency in emotional mood, and there are some changes in characteristic traits like being introvert, shy, quiet, and always looking tired. And behavioral change is related with habits and actions as well. We can see here the distorted relations with family and friends, emotional imbalance, sudden laughing or crying, crisis sessions, and physical balance problems, again, laziness, lack of motivation, and looking tired. Of course, after using substances, there must be some problems related with school or work, especially escaping, quitting, or in the different attitude, inability to fulfill responsibilities related with work or school, and of course, sudden failure in grades. And in family lives, if family members observe loss of prescripted drugs at home, or loss of cigarette packages, or if there are some alcoholic beverages at home, if they are consumed really fast, or if the bottles are disappeared, or the valuable goods at home disappeared for cash money, then they can think of an addiction problem, and also asking for lending money from friends and family can be seen. What to do if we observe this? Especially the family members or the significant others of the addicted individuals, they have to try to remain calm. They have to recall that this is a disorder. This is something that needs to be professionally helped, and they should connect with the person and the social environment. And do not force him or her to talk. She or he can talk to you when they feel ready. Do not intimidate or threaten. Sometimes family members do that a lot. And keep it confidential so that he or she can trust you and thinks that you can understand her or him. Then tells you the story and offer options. Don't push him or her just going to hospital for an inpatient unit. There are so many options for treatment. Talk about those. Seek for professional help and try not being judgmental. And it's a long process. You shouldn't give up easily. You should support him or her, and you should keep your patient and understanding attitude, because it's a long way. You cannot force anyone to quit if she or he doesn't want to. And the addicted person should be prepared for changing habits as well, not only quitting substances. She will be changing, or he will be changing habits, environment, and also lifestyle, because sobriety or cleanness remains within the right environment, healthy family relations, and the willingness to keep her mood, her situation sober and clean. And there are some life skills preventing addictions. These are anger management, stress management, communication skills, ability to say no, and problem-solving skills. That these are mainly developed during adolescent periods. And I would like to talk about treatment strategies very briefly. I am now over time, sorry for that. Intoxication treatment, detoxification treatment, and there is replacement therapy. This is also commonly applied with opioids, psychotherapy, individual and group, addiction counseling, psychoeducation, family counseling and family therapy, social support, medical support, and self-help groups like Alcoholic Anonymous, Narcotic Anonymous, or Al-Anon. Sometimes people think that detoxification alone is enough to get rid of addictions, but it's never enough alone. Addiction treatment starts right after detoxification, and it must be supported with psychosocial support. What does psychosocial support involve? Cognitive behavioral therapies, motivational interviewing, 12 steps approach, family counseling, relapse prevention, and also mindfulness-based strategies. Research shows us that these psychotherapy, psychosocial approach really work in addictions. And the person himself or herself should look for treatment and be ready for change. And constructing a right social circle is really important. And my last topic, I will be wrapping up with talking about CYEDAM, Turkish Green Crescent Counseling Center. We have a consultation hotline, psychotherapy services, and social support. And as a part of our social support, we have an outpatient rehabilitation unit, which helps the person for socially reintegrate. And under psychosocial support, we make extensive clinical assessments. We provide psychotherapy, psychoeducation, group therapy, family counseling, home visits, social support, and social rehabilitation. Now we have 41 centers in 36 cities, different cities, and also we have a center in North Cyprus, and our branches are expected to reach 100 in this year. Okay, thank you for your attention. I would like to hear your comments or questions if we have time.
Thank you so much, Dr. Malika, for this wonderful presentation. Indeed, addiction is not only a health problem, but psychological and behavioral change as well, which need to be highlighted and discussed by doctors and experts in order to find solution for this phenomenon. Now I would like to open the floor for the question and comments. We have maximum 10 minutes. Let me see. We have Ora Nebula from Indonesia.
Thank you so much, Chair, for the time. My name is Nebula, and I'm from Indonesia. So my question is regarding about the environmental, especially the government regarding these issues. Because when I did an exchange last semester in the Netherlands, I was surprised that drugs is distributed like freely. I mean, people can access and buy it in every corner of the streets, of course, with some regulations. Then I did some research and tried to have control on the substances because they want their citizens to have like a dirty hand on that substances in business, which will maybe lead to addictions and overdose. And in the contrary, in my own country, government prohibits those things like strictly, yet there hasn't been any effective way to get rid of those substances because people are outsmarting the government. So what is your perspective regarding these two sides of government dealing with the addictions itself in different way? Thank you so much.
Thank you for your question. I have visited Amsterdam and I was quite shocked as you a few years before, and it was like an experiment, a social experiment for me. And then after my visit, I tried to search for the rationale behind those very large perspective towards drug use. And I saw that they have their own strategy, like it's kind of a prevention strategy, but of course, I don't agree. And also my institution, Turkish Green Crescent, doesn't agree. We can think of it as a part of harm reduction. For example, they distribute cannabis in order to stop using opioid use, which will cost them, like in terms of health services or social stuff, it will cost very, very higher compared to cannabis use. I saw that they have a strategy like this, but I don't agree with this one. Because when you offer these drugs, these illegal drugs like cannabis in a social environment, and especially young people think that it's a part of a social life. It's like drinking Coke with friends. There are coffee shops which are called coffee shops, and you go there just to smoke cannabis. Even the branding of it is really interesting to me, and my perspective is definitely on the side that governments should ban using those illegal drugs, especially in public.
Thank you, Hojam. Next question from Abdul Latif Lawal from Nigeria.
Thank you so much, and thanks for the wonderful presentation. My question is that the effect of drug has really affected us in this country. We are being faced with a lot of insecurity, and most of the perpetrators of these evils have been found to be usually under the influence of drugs. And also, we now realize that even our artists, like the musicians and so on, they even found it very easy to display all these drugs they use while they are shooting their movies and so on and so forth. So the question is, the influence of drug is currently everywhere, and there are a lot of restrictions, but it is as if the restrictions are not there because people still found a way to get this drug. Isn't it possible for the international organization to come together and totally ban the production of these drugs? Is there no way to stop the production of the drugs, or the trees that are producing these drugs, these substances? Is there any way that this tree can totally be stopped, or what? Because the government, there are a lot of policies, and to some extent, even those that are asked to enforce the law are also one of those that are even breaking the law. So it is now becoming a general normal times. So what do you think? Can't the international organization harmonize a means to totally stop maybe production of these drugs, since they have a lot of side effects than the positive effects? Thank you.
Well, thank you for your question and comments, Abdul Latif. Well, this is a great wish. I wish they would stop, but I don't think so, because most of the countries, unfortunately, benefit from those productions. And also, some of those are used for medications, especially for cancer patients, for example. I don't think that it's possible to stop producing at all. I wish they could, but I don't think so. But they can come together to create some communication strategies. You talk about the role models in the society, like singers and actors using drugs or making films about using drugs. And as you remember, in my presentation, I talked about some role models in the family. Role models in the society are as important as the role models in the family. So they can support some role models with healthy lifestyle. For example, Yeşilay, Turkish Green Crescent, does that. They support these kind of figures, these public figures, or they fund some TV series showing a healthy life, supporting, motivating people not to use drugs, even cigarettes. This might be done, but I don't think that the production would be stopped. I don't think that all the countries would agree.
Okay, down last 4 minutes. We have question from Tani Barakat from Cameroon.
Hello, dear all. Thanks, Dr. Simsek. Listening to your presentation has provided me with a lot of knowledge. And the obvious reality is many youths out there are slaves to these drugs. Not being a drug addict, what's the study pathway to become a clinical psychologist like you and be able to help our fellow humans? And then the next question is, also at the level of youth, how can we raise awareness on all the consequences and ill effects of drug? Because most people are not aware of all these consequences. Thank you.
Thank you. I will start with your second question. If you try to tell the youth, the young people, to stop quitting or the harmful effects of substance use in like a lecturer way, they will not accept your message. You should find some creative ways, especially using social media, for example. There might be some graphics, some infographics, making them understand. For example, I don't know if you know the website 9gag. There are some very short videos about developing substance use in a person's body and soul, how it affects it. I can see that in my presentations, for example, at schools, students do not listen very carefully the written parts of the presentation, but when I show those videos, they watch them with very wide open eyes. So we should reach them with their way. I think this is the way we can like catch them. We should prepare messages like this. Now I forgot your first question. Amel, do you remember?
It's about how youth can raise awareness.
Okay, this was
Yeah,
the second one.
The first question?
Could you please repeat the first one?
Okay, the first question goes as follows. Not being a drug addict, what's the study pathway to become a clinical psychologist like you?
Okay, yes. Yes, it was. Not during my study, but at my work. In my work interview, they asked me whether I use any drug or tobacco or alcohol. Yes, it's a part of my job.
Thank you, Hojam. Thank you.
Ma'am, I meant like the career, like the field of study. Like, what did you study to become a clinical psychologist?
Oh, I study psychology and after clinical psychology masters.
Okay, it means someone from a different background cannot do like masters in psychology.
Sorry?
Means, for example, I'm from a computer science background. Means if I do, for example, masters in psychology.
Okay, I got your
like
question. No, you should study clinical psychology or psychology in graduate level, and after that you should study doctorate level training. Here in Turkey, if your background, your BA is different other than psychology area, then you should complete doctorate level training to work as a clinical psychologist. I hope.
Okay, thank you.
At last, I can understand and answer your question. Sorry
Thank
for
you very much.
understanding.
Thank you very much for this enlightenment, Dr. Malika. It was a very significant topic and the lecture was very fruitful. Çok teşekkür ederiz.
Thank you. Ben teşekkür ederim.
Rica ederiz.
Take care. Thank you.
Thank you so much.